Thank you very much for taking your time and adding this webinar to your schedule. I know that you guys are pretty busy. We're living like horrible times. All this is gonna be over soon. And we just have to stay positive. And you, please be safe, take care of yourself, take care of your family. And nothing, all this again is gonna be over soon. And we just you have to stay positive, okay? All right, so now this thank you is for letting me introduce you to this amazing world, the entrepreneur life. I also want to introduce you to our girls here in the office. Some of you know them, Valeria and Malai. They're my right and my left hand. You know these girls. Some of you know them. They can really cook. They can really make really good coffee. They can spoil you. So if you have taken a course with us before, I don't know, let me see. Yeah, some of you guys. So Valeria and Malai. All right, so this is how the course is gonna be, the webinar, I'll tell you. I'm gonna upload a document pretty soon on the computer. I'm gonna close my camera and we're gonna go ahead and go step by step of what we're gonna be discussing. It's not, I know a lot of you have asked about a whole course. We finally got it. And that whole course is in the website, in our website, the same way you register for the live courses, you can register for the online courses. We finally did it. We have been getting a lot of requests. We decided to do a month annual membership because we also gonna be sending monthly emails with new updates, not only from the government, but also giving you ideas on how to make your practice better and keep your practice up to date and in compliance with everything. But for now, we're just gonna discuss everything that you need as an individual and also as a corporation, as an organization, in order to meet all the requirements to have your business running, okay? Let me see, I know I wanted to say something. Okay, yes, it's not gonna be easy, that's for sure. It requires a lot of time, a lot of effort, missing a lot of family events, but it's totally worth it. So please don't give up. It feels amazing to sign your check and go on vacation, set up your own schedule, it's great. I want you to always keep that in mind. And nothing, let's start with this, let's do this. Okay, girls, I need you. Much better. All right. So you need to have an active license. If your license, if you are a new grad, because I think we have new grads in the webinar today, you have to apply for a license and it's $110. So what you basically need is the fingerprints. They also need to make sure that you have malpractice insurance in order to apply for the license. If you already have it, then you don't have to worry about it. Just make sure that it's active as well as your certification, okay? All right. Yes, I'll try to email this document as well, but I'm not sure if we're gonna be able to, but most likely yes, okay? Now, the protocol with a physician. You need a protocol right now in the state of Florida. You all know that you need to have a protocol with a physician in order to practice. Now, I get a lot of questions. They say, who can actually sign for this protocol? An MD or DO or a dentist can sign for the protocol. I'm sorry, I'm trying to look at the questions. If we can save all the questions for at the end, yeah, it will be nice, okay? Because I'm trying to look at the other questions and then I go over at the end. So you need a protocol signed by a physician. The physician doesn't really need to be in the practice when they sign your protocol. This is just a relationship that you have to have with the physician, but they don't have to co-sign your notes or anything like that. I have some people asking, oh, I thought that we don't need that anymore. You need it now, not until the new law is gonna be effective in July 1st, 2020. So until July, you need it. Now, There are certain requirements. It's not like we're still pending for the Board of Nursing to establish everything related to the new law. I can tell you that you're gonna need, in order to apply, because you will have to apply for that independent practice license or permit. You will have to apply for it. And in order to apply for it, you're gonna need 3,000 hours of clinical hours within the last 5 years. So if you are a brand new grad, you won't be able to. But it's fine because I think that we all need that experience. But you need at least, you need 3,000 hours. You're also gonna need 3 semester hours in differential diagnosis and pharmacology. Now, the Board of Nursing, they haven't established yet, like at what level, like what universities, what type of program. We have to wait for that, okay? In my case, I graduated in 2004, so I don't have that within the last 5 years. I will have to take those courses. For you, for those of you that graduated within the last 5 years, you have that, you took that while you were doing your master's, so you're good. But you're gonna need that. The other thing that you're gonna need to apply as an independent practitioner will be to have a liability coverage of 100 per claim, 100,000 or 300 aggregate. You have to have your liability insurance. Now we need it anyways. I know a lot of nurse practitioners are practicing out there without having a liability insurance, but you need one. And let's say, for example, that you're currently working for a practice and you are setting up a new practice and you already have a liability insurance with the doctor you're working with, you still need to have one for you as an independent provider. You will have to get your own one. But again, those are the requirements. Also, this is gonna work only, you can only apply for independent practice if you're gonna do primary care, okay? As specialties, they're not part of the law. They don't qualify. And nurse anesthetists, they don't qualify. It will work for, it doesn't mean that you cannot do certain things. Like I know I've been getting a lot of questions about aesthetics. It's kind of like aesthetics is not a specialty, it's just a procedure and a service that you're gonna be providing in the office, which is fine, but is for primary care, okay? Let me see, what else in that section? I think that's kind of everything. Again, we don't have everything yet because the Board of Nursing doesn't have the whole process. They haven't developed how they're gonna do it, what type of application, how it's gonna be. They don't have anything ready yet, but they're working on it, all right? Now, malpractice insurance, it's around $1,200 to $2,000 a year, and maybe a little bit more. I pay less than that because my policy is pretty old, but it's around there. I don't really have now, there's a lot of them. You can Google one. I don't think I have here the one I use, but try to look for a quote because there are a lot out there. And that, like you have to be careful, like how much money to pay. So make sure you do your homework and you try to get a good one. All right, MPI. Yeah, NSO is pretty good. That's actually the one I have. I forgot about it. Now, your MPI, you need your personal MPI. If you're practicing, you have your MPI, and that is your number. So even if you're working for a physician or a group, that's your number, okay? PICOS registration. You need your MPI. If you're gonna apply for insurance companies, if you're gonna prescribe medication, we all need our MPI, so you need to apply for it. Some people are already practicing, they don't know they have it, or they're working on still under the doctor. Make sure you have an MPI. Now, PICOS registration, you need to register with PICOS. If you're gonna be applying for insurance companies, you have to, PICOS is an internet-based enrollment. If you're gonna apply for Medicare and Medicaid, you need to be registered with them. If you're planning to order services for your patients like home health, DME, and all that, you have to be registered by PICOS and outpatient services, otherwise the other party won't get paid. So that is one thing that you have to keep into consideration, that you have to register yourself as an individual provider with PICOS, all right? Now, the DA license, you only gonna need DA license if you are gonna be prescribing controlled substance. If you're not planning to do so, then don't apply for it because it's $731 every 3 years. The way I see it, if you're planning to open your practice, try to do everything that you have to do. But if there's something that you can avoid, try not to do it until later on. But again, if you think that in your practice you're gonna need it, then you have to apply for it. And you can apply online. And it's 731. I'm trying to put like basically like the numbers that you're gonna need so you have an idea, okay? Now, credentialing up to date. With the CAQH solutions, this is a company, it's not charged for you, and you can register as an individual provider and you can have all your credentials up to date there. It's gonna be very helpful because when you are applying for the HMOs and either Medicare or Medicaid, if you have your CAQH number, that's all they need because all your credentials are gonna be there. So try to register with them and have it up to date because you're gonna need it for your credentialing whenever you started doing your credentialing, okay, for the process. Okay, that's basically all you need as an individual provider. Okay, now let's talk about institution because you're gonna open your business, but you have to be ready first as a provider. Now it's time to open your business. You have to select your business structure, either an LLC, a corporation, nonprofit, DBA. If you already have a business, let's say that you have it like Jose Fernandez, and it's a corporation, but now you can actually do a DBA. When you do a DBA, you just change the name. So maybe you don't really have to open up a corporation. You can still use that corporation. That's what I did with one of my corporations. I just did a DBA for my institution. I had a corporation for years. I wasn't using. Instead of opening a new one, I just did a DBA for that. You can do that as well if you want to. I recommend for you, like if you can do all this yourself online, right? But deciding which one, I think would be better if you talk to your accountant, whoever, you know, a financial advisor or something. Usually my corporation is a corporation, an S corporation. That is what worked for me and my family. So you have to kind of, in the course, we go over all this and explain each one. Again, we don't have that much time. We only have 1 hour. But you can go ahead and, you know, you can do this online. Come up with a winning name. This is very important. You have to try to, if you're planning to have a family practice, try to get a name that is not that specific. Try to get something more, again, not as specific, that you can actually do whatever. Because some people, I know some of my students were opening their business just like related to aesthetics because we do all this, I do all that here in the office, and some of them were doing that. I suggest for you, if you already have a company, let's say, for example, I don't know, beauty, something, just do a DBA and change it because under the new law, it's not gonna look right that, oh, you're doing primary care while you have a business that is just related to aesthetics, you know? So think about it. You will have to apply for an employment identification number. This is like the social security for your business, so you need to apply for it. Now, this is what's gonna happen. You're gonna open your corporation online. It's $70 that you have to pay for it. And then as soon as you open it, you're gonna start getting mails like, oh, you need your tax ID number, $300, $400, things like that. Don't pay attention to that because that's a ripoff. You have to go into the IRS and apply for that tax ID number. Okay, don't believe that mail because you're gonna be getting a lot of mail saying that, oh, you need to apply, is the law, things like that. Yes, you know that you have to apply for a tax ID number, but you're gonna do that in the IRS, okay, website. All right, now let's talk about developing a business plan. You will have to have a business plan for many reasons. If you think that you don't have the budget to start your business, you're gonna need some money, and either the SBA or your bank, they're gonna request for a business plan. In the course, I have a sample of a business plan that I developed years ago, and I recently reviewed it. You can use that one. It works for a medical practice pretty good. You don't have to be that creative or fancy. You also gonna need it probably. Some cities will require in order to give you a permit, because they wanna see what the plan is. What are you gonna do in your business? So some cities, they will ask for the business plan, but the business plan is mainly for the bank. And right now, the SBA has a lot of programs to give money for new businesses. So you need that business plan. Don't pay. I know there's lawyers, and they're gonna ask for a lot of money for a business plan. Please do not spend that money, because it's very simple and straightforward. I know they can get very creative and things like that, but that's money that you don't want to spend money in a business plan. You'd rather have a business plan that is very straightforward. Again, the sample that is in the course is pretty good. Just complete it, change few things. It's a Word document, so you can modify it, and you can bring it to the bank or SBA and apply for it. But you're gonna need one, okay? Now, office location, we have several options. When you're starting your business, you have to think about like, okay, because you're gonna have options. That's the beauty of this. You can have an office location, physical location, or you can do home visits and practice from home. When you do that, you're still gonna need all the permits and everything. It's just that you're gonna be saving some money in overhead, in rent or mortgage, which is pretty a lot of money. Or you can do a mobile clinic. Mobile clinics are, they're in right now. And it's a great option. As a matter of fact, I'm thinking in adding a mobile clinic to the practice right now, because a lot of people, they're requesting to be seen at home. Now, there's a difference between home visits and a mobile clinic. With home visits, you have to be a little careful, because there's a population that they don't really want anyone, they rather go to someone that has a business, that has an office. Like, okay, you come into my house, but if I want to go to your clinic, you have a clinic. So you have to be very careful about this. Now, you're going to be saving some money if you work from home and you just do home visits, that's for sure. But mobile clinics are really in right now, and it's just about getting like a nice car, like a van or something, that you can set it up there, or a trailer or an RV, and set it up as a mobile clinic. And then you go to places. I'll tell you my idea, what I would love to do. Florida, we had a lot of snowbirds. So you can actually, if they allow you to go into the RV parks, that is great. I have that idea. We have several RV parks in the area. I love camping. We have an RV and we go camping. And I said, you know what? It might be a good idea if they allow you, if the park allow you, for you to go with your mobile clinic to those places. And you don't need much. I'll tell you later, like if you are not billing insurance companies, basically you're not regulated by anyone. And I'll talk to you later about that. And I think it's a great idea. So think about it. I'm gonna go more into details later, but again, all is in the course. And please don't see me as, oh, Daisy's trying to sell the course. No, I'm putting everything and sharing everything that we have learned through the years there. And again, this is great, okay? All right, so let's talk about, let me see if I'm missing anything there about okay. So office location, if you wanna go ahead and decide to go with an office location, think about, you have several options, but one might be to rent a room in an office that is already there. If the office is already set up and you just wanna rent a room, don't be afraid to ask your doctor, your primary care doctor, or a friend, like, hey, I see that you're not that busy and you have a room. Can I rent that room? And most likely the answer will be yes, because who doesn't want money? They need money with help with the rent. So that's another idea that you can do, or just rent a whole place, which is pretty good, but you know, it's the average for a room is around $1,000 a month. For an office, depending on where you rent in or the location, it can be up to like 3,000 probably. So the best idea, I think, for you if you're starting will be home visits. But from home visits, I'll tell you, you need an office at home and you will do home visits, but you still need an office at home because every business needs a permit, okay? Or the mobile clinic, which I think is great. All right, let's talk about the certificate of use. Once you decide what you're gonna do, if you're gonna do it in an office or from home, you need a certificate of use with the city. You need to apply for that permit with the zoning department. And that permit is usually $110 in most of the city. I checked a couple of cities. And if they say yes, that you can practice, because I know you might go to an office or, oh my God, I love the office. I really want to start practicing here. And then you sign contract with the owner and everything. And then when you go to the city, guess what? They don't allow your business in that office. So the first thing you have to do is, let's say that you like an office, you like a building, go ahead and go to the city first. You're just gonna lose that $110, but you know that you will be able to do your business there. If they say no, then you can't. Now, if you're working from home, you also have to ask for it, because if you're doing home visits, you need to have an office at home for your paperwork. You need a location. And then some cities will allow that office at home. I had an office at home once when I used to do medical billing. My office was at home and I had a permit from the city. You have, now if you live in an association community, you have, you know, takes time. They might not allow it, but just find out with the city. If they say yes, then you just set up an office in your house for paperwork. And now that office needs to be HIPAA compliant and all that. And then you do home visits. A lot of doctors do home visits, okay? Now, for, let's say, for example, local business tax receipt. After the certificate of use, after they say yes, you can have the office there, then you need to apply for a business tax receipt, and that is with the city and the county. This is formerly known as the occupational license. So once they say yes, the zoning department say yes, you need to apply for an occupational license for the city and for the county. And it's usually about $100 to $150, depending on the amount of employees that you have. Again, if you're working from home, even if you're doing telemedicine, because remember, telemedicine is approved, many insurance, if you have at least one encounter with the patient. Everywhere that you're gonna apply to, you need to have, in order to run a business, what are you running your business from? From your car, you have to have something running your business. If you're running your business from home, you need a permit from the city. I mean, who's gonna inspect you? Who knows? Let's say that you don't apply, that you decide that you don't wanna apply for any insurance. No one is gonna ask you for an occupational license. However, you know that you need to have that occupational license. The minute you start applying for insurance companies, they're gonna ask you for your occupational license anyway. So you need it, okay? All right, now, I know that you guys might have a lot of questions about this, but please keep it and then we go over at the end, okay? All right, office decoration. This is pretty important, okay? You need to spend some money here. Even if you go and decide to do the mobile clinic where everybody seems to like the idea, you have to spend some money there. Remember what I told you, don't spend too much money like paying someone for a business plan and things like that. This one we need to spend some money because people like the atmosphere of feeling, you know, like at home. You need comfortable furniture like colors, coffee stand, Pinterest. I don't know if you guys are familiar with that that website, that application, but it will give you plenty of ideas, okay? But whatever you decide, make sure you do something nice, okay? Because that plays an important role, believe it or not. Now, Fax Services. You can use virtual phone systems. It's usually like around $50 a month. That is how I started. I started with eVoice and eFax. There are many out there. If you can just go online and pick one that it works for you, like have a virtual secretary while you start. Even after, like we even use it right now, we stay with eFax instead of having a line here in the office. I use regular phone system right now, AT&T, but no Comcast, but you can have a virtual phone system at the beginning, okay? Now, the website is very important. Create a website and social media. Believe it or not, social media platforms are the most powerful marketing tools when it comes to digital marketing. So you have to make sure your Facebook and Instagram, and you probably might need someone to grow your social media presence, because people are really before, oh, you know, so-and-so, oh, let me check in Facebook, oh, let me check in Instagram. And I had Facebook for, you know, a personal account, and Instagram, I still don't even know how to use it that well, but I have to add it because everybody was asking for it. I know you guys keep asking me questions about the eFax and the eVoice. Yes, you can transfer that to your phone, and I did it like that for a while, and it worked pretty good. So if, but again, you just have to check online. There are many out there. Okay, Facebook and Instagram, important. And what else? Now, let's talk about your biomedical waste permit. Biomedical waste permit, we all need it. There's few exceptions, but only after you get the permit. If you're renting in a place that they already have a permit, you don't have to apply for it. But if you're renting a room in an office that they don't have the permit, then you have to have the permit. You need an operating plan and an annual educational program for you and your employees. And you also need a contract with a transporter. The permit is $85, and usually the contract with the transporters are like $30 a month. You're gonna have, there's several, what I did in the course was that I put all the transporters that are approved per area. So you're gonna know like who you can contact in case that, that you need to apply for the permit. You also need an operating plan, and you have to educate your employees every year. When they come for the inspection, they're gonna ask for your plan, they're gonna ask for education. When I was by myself, I just had documented that I went over the training once a year, and I have it there. And they're also gonna ask for the receipt that you got from the transporter when they came to pick up the waste. Now, you can apply for an exception if you make less than 25 pounds a month, but you will have to have your have a permit, and then you can apply for an exception later on. That's in regards to biomedical waste. All right, now the CLIA waiver. This certificate is $150. You don't need it if you're not gonna do any wave rapid test right in your office. And I'm talking about UA, dipstick, or a hemoglobin A1C, or the blood glucose test. If you're gonna have one of those machines that are you can have like a weight test result right in the office, then you need to apply for the CLIA certificate of waiver. There is a huge list of tests that you can do in the office, and you get the result right away. I have it here in the office because I check blood sugar, hemoglobin A1C, and things like that. So if you're gonna do that, then you need to apply for it. This is not about doing blood work and sending the blood to the lab, okay? If it's just that, you don't need to apply for anything. But if you're doing those tests here that give results to the patient right away, then you need to apply for the CLIA certificate of waiver. Okay, now for your business, you're gonna need an NPI, and you can apply the same way you apply for your NPI. Now you're gonna apply for the business. You're only gonna need an NPI for the business when it comes to credentialing. At the beginning, if you're just gonna do cash-based patients, You don't need to apply for the MPI for the business. And you apply the same way and not charge. Okay, now let's talk about electronic health record system. They're getting pretty expensive. You want me to repeat about the MPI? Okay. The MPI, you have your MPI, right? For the business, you also need an MPI, but you basically won't need your MPI for the business until you start applying for credentialing, like to get, you know, like with insurance companies. I went ahead and applied at the beginning just to have it, because if you are applying for you as an individual, you, let's say, for example, Daisy, I have my MPI, but I also have an MPI for my business, for South Florida Preventive Care Group. And when you are gonna apply for credentialing for the insurance companies to get your provider numbers, they're gonna ask for your MPI, personal MPI, and the MPI for your business. All right. Now, EHR, electronic health record, is usually the one that I use right now is Practice Fusion. It used to be free, but now it's $99 per provider. It works very good. And you can integrate telehealth, medical billing, and everything with it. When you are trying to get an EHR, make sure that you can integrate those things, because at the beginning you might not do billing, but yes, telehealth, and yes, keeping your medical records. You don't really want to go around with a lot of paper, so it works great. Just your, yes, it's $100 monthly per provider. That is with Practice Fusion, but there are many out there. Practice Fusion, and it used to be free. It was very good, but 99 is still not bad. And I do everything in Practice Fusion. My appointments, I can see them on, you know, my phone, but there are a lot out there. Just do your homework. And if you know someone, and if you're familiar with the system already, go ahead and try to contact them, okay? Practice Fusion. Sorry for my accent. Okay. Yes, Practice Fusion, Sandra. All right. Now, ACA, license with ACA. Okay, Agency for Healthcare Administration. Who's not afraid of these people? I think everybody is. But no, if you need to apply, go ahead. The fee is about $2,000 every 2 years, and for an exception is $100. Now, you don't need to apply for ACA if you're not billing insurance companies. That's why I say, if you start in your business and you want to start doing, because I'm gonna give you a lot of ideas that you can do at the beginning before you start your credentialing. Or while you do the credentialing, when you start the credentialing process, you can add Fax Services there. But if you're not billing insurance companies, you're not regulated by ACA. Currently, I do not bill insurance companies. I started I'll tell you a little bit about my story. I opened the business to do basically primary care, preventive care. And I wanted to apply to Medicare. I wanted to apply to Medicaid, private insurances, and all that. But things were getting very difficult with the credentialing process. And then I decided, not difficult, but was years ago where the health system was changed. And then everything changed. And then I decided to go ahead and start my own medical plan, cash-based. And it was working pretty good. And so far, it's amazing. Now I'm gonna apply again. I'm just gonna apply to Medicare and Medicaid. But I've been running my business for 7 years, just cash-based, without adding any insurance company to my panels, and has been very successful. I still have a question there in regards to billing. Yes, billing, most of the EHR, electronic health records, they integrate billing to it. So I don't know how much is per claim. Most of them are gonna ask you for amount of patients. So I'm not sure with Practice Fusion how much is it, but that's just for electronic health record. Billing, it depends on the amount of claims that you generate every month, and most of them are like that. Now, for billing, I I tell you this, when you're gonna start doing your billing, I know this might sound crazy, but if you can learn billing and do your billing, I recommend that 100%. I have a good friend. Her husband is internal medicine, and she hired like two different billing companies. Nothing wrong with that, but it's your money. You really want to make sure that even if you're not doing the billing, you want to make sure that you can follow up, that you can see where your claims are. And these days, billing is so easy that basically, if you hire a billing company, you are doing the billing for them because you have to do the documentation. You have to put the diagnosis codes. You have to actually go and put the procedure codes. You're giving everything to the billing company. The only thing they're doing is just adding, okay, now the claim, the procedure code, the diagnosis code, send. Procedure code, diagnosis code, send. You're doing everything. Before they used to do a lot, but now it's like you're doing the pre-billing yourself in the office. So, and the billing companies, actually the eAssure, the billing portion, they train you. They give you the option to do it in the office or for them to do it. So I recommend for you that once that comes, please try to do it yourself. Try to do it in office. Don't send it out, okay? Okay, so now let's talk about ACA license because I know, let's move on to this because we only have 20 minutes left. ACA license, again, if you're not billing insurance company, then you don't need to apply to ACA. If you're gonna start billing companies, then you have to apply. But I will wait until July because there are gonna be a lot of changes in the statutes there for Agency for Healthcare Administration. Once you become an independent provider, then wait to apply and see if you're gonna start credentialing and all that. But you can start the whole process without even having your protocol because you only gonna need that protocol to once you start touching patients. But you can actually start doing the whole process. No one is gonna ask you for that protocol. The city is not gonna ask you for the protocol. The bank is not gonna ask you for your protocol. You can start doing everything now so you are ready. That's my suggestion. You have to start now. All right. So the ACAs are okay, that credentialing. If you're gonna start applying for the different plans, health plans, and Medicare and Medicaid, you're gonna need a letter of intent. You don't, again, with the same thing, you don't have to be so, there's certain aspects that you have to cover, and in the course, I have a sample. Again, it's a Word document that you can modify, and you're gonna use that every time you are applying for an insurance company. Medicare and Medicaid, they don't really need a letter of intent. Some HMOs, they have their own letter of intent that you just have to complete them. I know someone said that Blue Cross Blue Shield will ask you for the protocol. Yeah. However, I'm talking about like getting everything ready. I'm not saying credentialing. I'm talking about getting the office running and everything that you need, okay? Because yes, HMOs will ask you for that, for sure, for your protocol. When you go into credentialing, yes, they will ask you for it. But what I'm talking is like when I said that they're not gonna be asking you for your protocol, will be like, I don't know, more specific, like pharmaceuticals and things like that. And the city, if you wanna get your permits, or your loan, if you wanna try to get a loan for your business, okay? Now, applying for your Medicaid, you have to have your business totally running before you apply for Medicaid and have everything ready. And that goes with your protocol, okay? We're almost done. So let me finish and then I'm gonna go over all the questions, okay? So credentialing will be letter of intent. This is Medicare. These are the applications that you need to complete for Medicare. And will be one for you as an independent provider. It will be one for the business, and then will be one to be assigning your benefits to Medicare. That means that you're gonna accept whatever Medicaid pays you, okay? So these are the three that you need to complete. And you also need to apply for, I mean, if you want to apply for Medicaid, all those applications are online. Now, there is another permit, and it's the healthcare clinic establishment permit. And it's 255 every 2 years. You only need to apply for this permit if you're gonna be buying medications in the office. And I'm sure that most likely you will, because if you're gonna do PPD test, that is considered a drug. If you're gonna do aesthetics later on, Botox fillers, all that, you need to have that in the office, vaccines and things like that. So if you're gonna have that in the office, you need that permit. However, if you are the only one and the only provider buying those medications and have it there and you have full control of it, you don't need to apply. Please make sure, and it's like that. I mean, you know, like you're gonna have a lot of people that are gonna tell you, oh yeah, but you need that permit. No, you don't. And you can call them and ask them. If you just tell them, it's only me for now at the beginning. I'm just trying to tell you, like, I mean, if you're more people in the office and you're not gonna have control of the medications, then yes. Otherwise, you don't need it. But that's the name of the permit, healthcare clinic establishment permit. But it's only if you're gonna buy medication for the office, you're gonna have it, and if more than one provider. But if you have full control of it, then you don't need it, okay? You will have to set up contracts with different lab companies in the area, or you can use Quest or LabCorp. But I really like to work with companies in your area so you can start building your network. That would be good. Make sure you ask for a fee schedule, because you can always offer a good panel. That's what I do to my cash patients. You also need staffing. At the beginning, most likely you're gonna do everything. That's what I did. I will answer the phone. I had an e-voice that will say, like, for the front desk, press 1, for the nurse, press 2, for Daisy, press 3, and everything will go to my phone. So most likely that's what you're gonna do at the beginning, and it's totally fine. But honestly, once you start growing, you're gonna need someone for the front desk for sure. A medical assistant, you can add that later on, but for the front desk, you really need someone, because you might miss appointments and things like that, and you might not be available. So that is something that you might be able to keep in mind. These days, maybe you can have someone that can answer the phone from home, and they, you know, if you really teach them what they have to say and about your business. Bookkeeping and accounting, please, yes, this is important. It doesn't really have to be an accountant, as long as, you know, if someone that is recommended by a good friend or someone that is good, you don't really need an accountant. Don't spend your money with that. We don't have an accountant, a CPA. But she is great. Our accountant is amazing. She really knows what she's doing, and she's always telling us, like, giving us advices. We meet every month, and we do our numbers and our tables quarterly. That you need someone to advise you properly in regards to that. That is one thing that I don't know too much about it, so that's why I hire someone for it. Now you can contact a specialist in the area and outpatient centers to start building your network. Once let's say you're doing your primary care, make sure you know in the area the cardiologist, nephrologist, the GI, talk to them, visit them, say, listen, I'm opening my practice, I want to start referring to you, and things like that. All right, so now, let me talk about this really quick, and it is adding cash-based services while you're getting all your credentials going. This is a big plus. As a matter of fact, I started doing this when I was doing my credentialing, and then I stopped my credentialing. And now I'm gonna start all over again, because there is a huge need, and I really love what I do, and I'm gonna hire more people here in the office. So I think this you have to do. I'll tell you, trying to have your own your own medical plan is a good idea. They can pay you like a monthly fee, $45. That's what I have. They pay, and that covers 12 visits a month. 12 visits a year, like one visit a month, and if blood work, like a CBC, CMP, lipid panel, UA, um, vitamin D and more specific labs. I charge a little bit more, but I have a great contract with my lab. So I also make money out of it, and it's not too expensive. Sometimes I have a lot of people that come to me, they have insurance, but if they go to their doctor, their deductible and copay is a lot higher than what they pay me. So they still come to me. I use two labs. Finlight Lab is a good one. They can give you a very good price. And also, there's several in the area. I don't know, I'm in Davie. But you can find LabCorp and Quest will give you a very good deal. But try to get a local lab. You might find, but Quest and LabCorp, they can give you a very good deal. Now, aesthetic procedures, some of you might not be, interested in doing them. I wasn't at the beginning at all. I wasn't into it at all, but the patients were the one asking for it. I was more concerned, my background is nephrology, so I really wanted to help all this community, like fixing the blood pressure, the diabetes, trying for them not to get, end up in dialysis, and what they want was actually their wrinkles to be removed. And I decided that I wanted to add aesthetics to my practice. Not only do that, but add it to it. And Botox, dermal fillers, PRP, great asset to your practice. Now, weight loss program is also good. Actually, right now, I don't have anyone because we have to stop and close the office. But we had like 12 or 14 people in the weight loss program with very, very good results. We're using MIC with B12 and putting in a very good diet regimen, and they're doing very, very good results. And that will bring you a lot of patients to your practice, and it's cash. IV nutrition also, we added, I forgot, like a few months ago, and has been a huge thing in the office. And you can, it's very, very profitable. You can really make a lot of money with this. And this goes with weight loss as well. Now, the medical service, setting up your own medical plan is a great idea, and do the home visits. Now it's 6:51. Let me answer, and you can have all this training with us online or live. Before we finish, the course, here is the website, is $249 a year. But with this coupon, April 3rd, like this, capital letters, you can get $100 discount, and it's only $149 a year. This is just like $12. Again, register for it if you can. Let's say that a year passed and you didn't do anything, just stop the membership, and that's it. You can stop it at any time, but everything is there, all the forms, consents, protocols, everything, all the websites that you have to go, the business plan, sample of the protocols if you want to start doing now. And you're going to be receiving monthly letters with all the updates, with the new law and everything that you need in order to keep your practice running, and in compliance. Now, let me go really quick to some of the questions that you are, all right, let me also on. Okay, Andrea, you asking me about the hours? No, we don't know yet. I don't have an answer for that yet. As soon as I have the answer, I'm gonna notify. The way that I have to notify, again, all the updates. It's a lot going on. The Board of Nursing is not ready yet, and then all this happen. We don't know. Most likely, it's gonna be at university level. But yes, looks like we have to go back to school and get those hours, which is totally fine. Now I'll be doing IV therapy, Beth, chelation, ozone. That's amazing. Yes, the minute you're touching the patient, you are practicing as a nurse practitioner. So you need, you're talking about independent license. No, you just need to be trained. That is part of your scope of practice, that you shouldn't be doing something that you haven't been trained. And ozone therapy, chelation, and IV hydration, vitamins. Hydration is not part of our training, so you do need a training for it. As a matter of fact, I'm gonna be training in all zones soon because I'm gonna be, I was already trained. Let me go ahead and put the camera again. So please take a picture of this, the website and everything. Girls, how to, I really wanna see you. Here we go. Oh no? All right. Just help me here. Okay, I want to see the shot. Okay, let me see the shot again. All right. Okay, so okay, let me go back here. Thank you very much. Yes, please. Thank you, thank you, thank you. Is there an email we can connect you with more questions? Yes, the same email you got, catrainings@gmail.com. You can send some emails there. But again, in the course, everything is there. Once you register, and I'm not saying it's just that it's a lot of you and all the information is there. Once you're there, if you have any question, but I really try, our team, we try really hard to put everything there. But if you still have questions, yes, sure, that's one of the benefits of paying the membership, okay? So if you're a family nurse practitioner, but you do rheumatology, can you open your own practice July 1st? Yes, you'll be able, as long as you have your permit as an independent provider, which we don't know yet how the process is gonna be. It will be an application, of course, that you have to complete, and then all those requirements that I mentioned, but you won't be able to say that you are doing rheumatology though. It's just for primary care, okay? However, you can see your patients and treat them. It's like nephrology, like you know, and then at the end you can always refer. But yes, it will be for primary care. All right, Laura, I currently practice under a medical group and I have generated patients on my own, but once you how to deal with your own patients. It wasn't hard. You're gonna need right now. When I started, it wasn't that hard. These days, Instagram, Facebook, that's how you promote your service. A lot of marketing, a lot of marketing. Before initial follow-up visit is around $150. And follow-up visits will be like $50. That's good. Send us the link again. The link for the course is CEA Trainings, catrainings.com. Maybe I can send you an email again with that so you can register. And again, that coupon is gonna expire tonight at 11 p.m. And that coupon is coming April 3, is coming April 3rd. That's the coupon is coming from the platform, and you save $100, okay? I'm working in an outpatient private practice with a collaborating agreement, counting at 3. Yes, yeah, collaborating agreement still count on the 3,000, yes. Thanks very much. Find a physician for the protocol. New physicians, young physicians, they will sign for it better, okay? All right, so girls, really quick, we don't really wanna live without if you have taken a course with us before, you're very familiar with this at the end. So we wanna share, we're gonna actually, this is for you. Cheers for a great future, for victory, because I know that you all gonna do amazing. And please don't give up, try. It's a lot of work, but you can do it. And again, I think I'm gonna have to do this again because we're having so much fun. It's a lot of information, but everything is in the course. If you're gonna, please register. If a year comes, it's only $149 tonight. and everything is there. It's totally worth it. Don't pay a consultant. It's too much money. You can do this yourself and everything. That took me years. It's not something that I just sat on my, sofa and prepared for a couple of nights. That's years of experience and years of doing this. So please do it. Don't give up. I know you will do it. Start looking for a name today. If you have your husband or your wife or your significant other next to you right now, cheers also. And good luck. Thank you. Thank you.